As with any surgical procedure, complications can occur after bariatric surgery. You may have even heard the occasional horror story and you may have some concerns. It is true, the risk of bariatric surgery was much greater when it was first developed than it is now. However, the latest data suggest that current bariatric surgery is safer than having your gallbladder removed. This reduction in surgery over the years is mainly due to the advent of minimally invasive techniques and the experience we have gained with these procedures. Having said that, let's look at those rare but important complications in more detail. Staple or suture-lined leak is the most feared complication of all. It can make a patient very sick very quickly and can even potentially be life-threatening. Management of a leak is difficult and often an emotionally draining experience for both the patient and the surgeon alike. Wound healing is a natural physiological reaction to injury. Like a skin wound heals, the internal cut edges sealed with staple lines heal too. This means new tissue growth will bridge the gap and fuse the tissues together. Although tissue healing is an ongoing process to come to full maturity, by the end of the third week, the strength of the bond of healing tissue is mostly sufficient to prevent any leakage. However, in the first 3 weeks, without the support of the tissue healing, the staple line and suture lines need to be watertight. Any failure will lead to leak of stomach and intestinal fluid into the body cavity. Leaking fluid contains corrosive acid, bile, digestive juices and bacteria that can lead to tissue damage, infection and a massive inflammatory reaction. Although reported chance of staple line leakage is about 2%, our experience of a staple line leak rate is much less. Careful patient selection and preparation, technical refinement and surgeon's experience contribute to minimizing the risk. There are a host of patient factors that can increase leak rate. Revision surgery, particularly after a previous gastric band, increase this chance significantly. Smoking, some health conditions and medications are all important factors. From the patient's side, strictly following the postoperative instructions, including strict diet plan in the high-risk first few weeks, is very important. Intense pain is the main symptom. Tissue damage and infection lead to severe pain. This is usually felt at the upper central part of the belly, under the left rib cage, or referred to the left shoulder. It's a severe pain that gets worse with movements like breathing, coughing, sneezing, or even with drinking. In addition, racing heart, fevers, increased respiration, nausea, feeling ill and anxious are common symptoms of a leak. If you experience these symptoms, you need to contact your surgeons for advice without a delay. As soon as a leak is suspected, urgent medical management is the most important. Generally, the management involves cleaning the leak content, treating the infection, and supporting the body with nutrition and allowing time for healing. First step is to return the patient to the operating theatre and laparoscopically washing and cleaning the abdominal cavity. We also leave drains or tubes to facilitate drainage of any further leaking fluid. At the same time, a special dual-channel nasal feeding tube is inserted for feeding and sucking out corrosive fluid from the inside of the stomach tube, so nothing available for further leak. Infection is treated with antimicrobial agents. These measures together lead to healing of the leak site in a majority of patients. When initial measures fail, many other secondary options are available for leak management. As you can see, management of a leak seeks mainly to support the body to facilitate natural healing, which can take a variable and unpredictable amount of time. This is often weeks and sometimes even months, and most of that time as a hospital inpatient. Bleeding is rare, but still the most common complication after gastric sleeve or gastric bypass surgery. Chance between 1 and 4%. Most commonly, bleeding is into the abdominal cavity from the raw cut edges of stomach tube, intestine or fatty apron called omentum. In addition, after the gastric bypass, rarely bleeding can also be into the intestine. Usually, there is only minimal blood loss, if at all, during bariatric surgery. In the immediate aftermath, the blood pressure can be elevated due to post-op pain and the stress of the operation, which increase the risk of bleeding. If you are on blood pressure medication, they should be continued without interruption to prevent high blood pressure in the post-op period. Blood thinners and bleeding disorders increase the risk of bleeding, which needs expert management around major surgery. It is very rare for the bleeding to occur after the first 24 hours. During this period, you will be closely monitored for any evidence of bleeding. Most postoperative bleeds are self-limiting and need no further action. Sometimes a blood transfusion becomes necessary. Very rarely, patients need to go back to the operating theatre to make sure there is no ongoing bleeding. Cleaning the abdominal cavity of free blood also can reduce pain and enhance recovery. Forming blood clots in the leg veins and shooting them into the lungs, known as deep venous thrombosis and pulmonary embolisms, are rare complications. This is a relatively common issue after major limb surgery due to immobilization. Fortunately, after laparoscopically performed weight loss surgery, there is minimal pain and hence quite mobile, making this risk much less. Avoiding dehydration and early mobilization are the main factors to minimize this risk. Other rare complications can occur. Accidental injury to internal organs including bowel, spleen, liver have been reported. Risk of accidental injury is higher during revisional surgery and particularly high if you have had previous open abdominal surgery, which may have led to intra-abdominal adhesions. Wound infection, port site hernia, risk of air embolism and need for open surgery are rare problems. If a rare complication occurs, the final outcome depends on how quickly you have access to your surgeon to get the problem sorted without delay. At WA Weight Loss Center, my patients are encouraged to contact me directly in such an event to minimize the delay.